$13,493. I want you to just let that number sink in for a second. That right there is the staggering financial reality of what the average American family spent out of pocket on healthcare in 2022. It's a massive, massive burden. But what if I told you there's actually a way companies are fighting this, a way they're actively improving their employees' health and doing it without spending an extra dime?
Welcome to this explainer. Today, our goal is to reveal exactly how modern wellness programs are leveraging existing tax codes to combat workplace burnout. And honestly, the absolute best part about all of this, we're going to look at how it's being done at a zero net cost to both employers and employees. I know, it sounds a little too good to be true, but as you'll see, it is entirely grounded in strict financial compliance.
So, here's our roadmap for today. We're going to cover the true cost of burnout, the shift to preventive care, specific stress-beating benefits, the tax rules that make this possible, and finally, how to set it all up without a massive headache.
Let's start right at the beginning. Section 1, the cost of burnout.
We are caught in this massive dual crisis right now, aren't we? You've got ever-rising healthcare costs for employers on one side and this devastating human toll of stress on employees on the other. I mean, look at this. 60% of the U.S. population suffers from at least one chronic illness. Think about your own team for a second. That means more than half of your workforce is likely battling silent struggles, stuff like depression, obesity, hypertension. And what does that lead to? It leads to increased absenteeism, it leads to people showing up to work but being completely distracted by stress, which ultimately means a huge drop in productivity and morale.
Which brings us to Section 2, shifting to preventive care.
The solution to this crisis isn't just, throwing more sick days at people. It requires fundamentally shifting how we approach corporate health from the ground up. Think about it. We are so used to a reactive approach to medicine, basically waiting until an employee is totally burned out or physically ill before we intervene. It's like waiting for your car's engine to start smoking before checking the oil. A proactive, preventive model flips that entirely. It's about getting ahead of the curve to reduce the impact of these negative health events before they derail someone's life and their career.
So, how do we actually do that in the real world? Well, the core methodology is remarkably straightforward. You identify the risks, you mitigate those risks, and you continuously monitor them. It sounds simple, right? But why does this matter to you? Because the data completely backs it up. A validated third-party study actually showed that using this exact proactive approach resulted in a massive 70% decrease in high-risk categories across the population. 70%. That is a very real, tangible reduction in chronic diseases and hospitalizations. Let's move on to Section 3, benefits that beat stress.
We've talked high-level strategy, but let's get into the weeds and look at the specific, human-centric benefits that directly tackle the burnout your people are feeling every single day. We aren't just talking about a generic gym discount anymore. We're talking about comprehensive support. Imagine an employee having a panic attack at 10 p.m. With these programs, they have 24/7 access to mental health behavioral therapists, literally right from their phone. Add to that an employee assistance program, unlimited virtual urgent care with zero copay, and unlimited personal appointments with an RN health coach. It is healthcare that meets them exactly where they are.
But it goes even deeper than traditional care. Modern wellness has become incredibly holistic. It offers tangible, science-based services to relieve real-world, everyday stressors. Because let's face it, life is complicated. If an employee's drowning in student loans, there's debt relief coaching. If they're dealing with trauma, there are PTSD recovery tools. There are even programs for social anxiety and smart, sober living. By treating the whole human, you are actually curing the burnout at its source.
All right, let's look at Section 4, decoding the tax magic.
Now, I know what you're probably thinking. As incredible as those human-centric benefits are, the huge, flashing financial question remains, how on earth does an employer actually pay for all of this? Well, the answer isn't magic. It's actually a hidden gem right in the IRS tax code. Specifically, the Section 125 cafeteria plan. This allows employees to pay for qualified medical and wellness expenses on a pre-tax basis. And by doing that, it lowers their overall taxable income. This single, brilliant mechanism completely flips the script on how we view the cost of employee benefits.
Let's break down how the precise mechanics work out in reality. Because the wellness contribution is deducted pre-tax, the employee's taxable income drops significantly. For the employer, a lower taxable payroll means an immediate reduction in FICA tax contributions. And those FICA savings, which average around $650 per employee per year, by the way, are what effectively fund the entire administration of the wellness program. Boom. You've just created a zero net cost scenario for the company.
Naturally, if you're an employee and you suddenly see a brand new deduction pop up on your pay stub, your immediate, totally valid reaction is probably a panicked, Wait a second, doesn't this reduce my take-home pay? Or what about my Social Security?
And the answer is no, it generally doesn't. Because of the way pre-tax deductions offset the tax burden, the net pay often remains completely unchanged. Actually, scratch that, it gets better. Through wellness rewards that are built into the program, employees actually see an average of about $100 extra in their monthly take-home pay. As for Social Security, yes, reported wages are slightly lower, but the impact on future benefits is absolutely minimal, especially when you compare it to an immediate $100 monthly raise and massive life-changing health benefits today.
Okay, so next up is the employer's top legal concern. Any good HR director or CFO is going to take one look at this and ask, all right, is this program actually compliant with the Affordable Care Act and IRS requirements? The answer is a definitive yes, but there is a very important distinction to make here. This program is a supplement, not a replacement. When it's integrated alongside an existing ACA-compliant group major medical plan, it strictly aligns with IRS Section 125 and Section 213D rules. It acts as a fully compliant wellness guardian that works with your existing insurance, not against it. Which brings us to our final part, Section 5, Seamless Setup and Compliance. So, the money works, the laws work, but what about the actual logistics? A great idea on paper is basically useless if it causes a logistical nightmare for your staff. I can almost hear the exhausted HR managers out there sighing and asking, is adding a completely new wellness vendor going to bury my team in an avalanche of compliance paperwork?
Prepare to be relieved. The employer workload is astonishingly minimal. We are talking, on average, about 90 seconds per pay period for payroll reporting. 90 seconds. The provider acts as a fully managed service partner. They handle the compliance tracking, the document storage, all the automated employee communications, and the participant support. You literally just upload a recurring report to your payroll system, and you're done.
And the rollout is incredibly fast. From day one of signing the initial agreements, to week one of collecting the census data and proving out the savings, to finalizing the plan documents in week 2 and finishing up with payroll setup and employee education in week 3, it is a seamless onboarding process that takes just weeks without bogging down your internal teams whatsoever.
So when we zoom out and look at the big picture, the contrast is kind of night and day. Without a program like this, you are stuck in this endless cycle of rising healthcare claims, reactive medical treatments, and deeply stressed out employees. But with this program, you transition to proactive wellness, you generate real FICA tax savings for the company, and you deliver incredible benefits at a zero net cost. It is quite literally the definition of a win-win scenario for both the human being and the bottom line. Let me leave you with this one final thought. The health of your people will inevitably become the health of your company. That's just a fact. So if there is a fully compliant, zero net cost way to give them the physical, mental, and financial support they so desperately need, what is it costing you to wait? Let's stop accepting burnout as just a cost of doing business. Thanks for joining me on this explainer. I really hope this sparks some curiosity on how you can revolutionize your own workplace. Until next time.